Wednesday, the 24th day of the month of March, but it's also the World Tuberculosis Day, a day set aside to create public awareness about the global epidemic of tuberculosis and efforts to eliminate the disease. But this year's commemoration comes at a time when the world is largely preoccupied with containing the spread and impact of COVID-19. So this morning we talk about, we take a stock of the country's fight against TB amid the coronavirus pandemic. A very good morning and welcome to the show. My name is Victor Kiprop and this is your world. The world marks the International TB Day today. We give you an appraisal of how the country is managing the disease in the middle of the COVID-19 pandemic. They spread in the same way and the symptoms are nearly similar. We tell you how COVID-19 has affected TB patients in Kenya. African leaders pay tribute to late Tanzanian President John Pombe Magufuli. And divorce cases in China are rising, and the services of this marriage counselor who live streams his counseling sessions are in huge demand. Right, and in relation to that discussion that we promised you about tuberculosis in Kenya, on our question of the day, we asked you, do you know anyone suffering from TB? Do you know anyone suffering from TB? How has the COVID-19 pandemic affected how they treat and manage the disease? Remember, you could be part of this discussion using the hashtag #NewNormal on Twitter. Tweeters at NTV Kenya, at Victor Kiprop _. You could also be part of the conversation on Instagram and Facebook, where this conversation, of course, is ongoing. All right, just before we get into that, let's give you an update of what else is happening, especially with regards to that COVID-19, the state of COVID-19 across the world and in Kenya. These are the latest numbers according to Corona Tracker. Globally, 124 million people, 104. That's the number of people who have been confirmed with COVID-19 across the world so far, according to Corona Tracker. 100,827,697 of them have so far recovered, and sadly we've lost 2.7, that is 2,746,242 of them. Let's bring this the issue closer home, and in Kenya, 123,167. That's the number of people who have been confirmed with COVID-19 in Kenya so far. 90,586 of them have so far recovered. And sadly, of course, we have lost 2,048 people to COVID-19. And of course, we take this chance to, of course, remind you again to continue, of course, following the protocols that have been set out by the Ministry of Health so that we could all play our part in controlling the spread of this deadly disease in the country. Okay, let's also give you an update of what else is happening across the world. And presidents of various African nations, including South Africa, Kenya, and the Democratic Republic of Congo, gave speeches at Monday's state funeral of former Tanzanian President John Pombe Magufuli, who died last Wednesday. The country's new president, Samia Suluhu Hassan, has announced a 21-day mourning period. The late president will lie in state in several locations across Tanzania before his burial this Friday in his hometown of Chato.
Twaomboleza kumpoteza rafiki yetu, ndugu yetu, mchapakazi, Mheshimiwa John Pombe Magufuli, rais ambaye ameheshimika sio tu hapa Tanzania, lakini kwa Afrika Mashariki yote, kwa Afrika yote na kwa dunia yote. Kwa muda wa miaka michache ameonyesha ya kwamba sisi kama Waafrika tuko na uwezo wa kujitoa katika dependence ya watu na nchi za nje, na tuko na uwezo kama Waafrika kusimamia uchumi wetu na kuhakikisha ya kwamba wananchi wetu wametendewa haki. Kwa muda mfupi tumeona kazi ya mabarabara, tumeona kazi ya stima, tumeona kazi ya ujenzi wa airport na mambo mengine mengi ambaye itakuwa ya manufaa kwa Watanzania na pia ambaye itatusaidia sisi wote wana East Africa kuongeza na kuzidi kufanya biashara pamoja na kutulete sisi wote tuwe kitu kimoja na wananchi wa Afrika Mashariki ambao wana uwezo.
Elsewhere, Denis Sassou Nguesso has been re-elected as the President of the Republic of Congo with 88.57% of the vote, according to provisional results released on Tuesday, even as opposition supporters of mourned Monday's death of Nguesso's main challenger, Guy Brice Parfait Colelas. Colelas tested positive for coronavirus on Friday afternoon, 2 days before the Sunday vote, and on Saturday, he posted a video from his sickbed declaring that he was battling against death. The 77-year-old Nguesso has been in power for an accumulated 36 years, first taking helm in 1979, then again in 1997, after losing the country's first multi-party elections in 1992. From Central Africa to West Africa now, and protesters blocked a highway outside the northwest Nigerian city of Kaduna on Monday to demand the release of kidnapped students. Several dozens of protesters barricaded the road outside the Federal College of Forestry Mechanization on the city's outskirts, disrupting traffic. Gunmen are still holding 39 college students who were seized from hostels in a raid on March 11th. The military rescued 180 other students and staff.
Looking at this school alone, you should know that it is poor people that are here. Poor people's children that are here. If any big man children should be here, I mean, should go to school. It's either they go to private university or they go to abroad.
Because tomorrow they will be old, and these children will be the one to take over. Yes. Father, we beg on you. We have cried enough. Yes, Lord. We have called on you that these our children are released. Amen. Our neighbor students are released. Amen. Whoever is in authority that is not doing what he's supposed to do, Father, this night, that person will not have a good sleep. Amen.
And to a story that will bring us into today's discussion. At the very beginning of the COVID-19 outbreak in Kenya, the government implemented a series of multifaceted public health interventions and enforced them strictly throughout the country. These measures proved successful in mitigating the spread of COVID-19. However, they could have a negative impact on tuberculosis control in the country. On one hand, the stigma associated with COVID-19 pandemic and hospitals at the onset discouraged people from seeking medical attention, but on the other hand, the measures reduced transmission of TB occurring outside the household. However, TB, like COVID-19, is an airborne disease with similar symptoms and could lead to discrimination, which could interrupt the treatment of patients who need to be on strict regimen. Compounded to the stigma, the cost of treatment makes the situation more difficult for patients and caregivers.
Japokuwa ninasonga, nasikia sina nguvu, ninakaa chini. Mzee wangu pia saa hiyo hana pesa. Kazi yenyewe ni hiyo ya bodaboda na pikipiki pia si yake. Wewe mwenyewe una pesa hata za kwenda matibabu.
Ilikuwa changamoto sababu wajua kitakuwa na wale watu walikuwa wanafanya nao, wengine mali napoteza, wengine hakuna pesa. Hata wakati wa msimu wa corona kazi ilikuwa ngumu, na ule ngumu mpaka sasa hii kazi iko ngumu. Ni challenge lakini itaisha.
Mtu ambaye ana TB akikohoa, vile viini vinazunguka kwa hewa. Yule atakayekutana na hiyo hewa akivuta ndani atakuwa ameambukizwa. Lakini inategemea na kinga za mtu.
All right, let's now get into that discussion about the state of tuberculosis in Kenya, measures that the government are trying to put in place to ensure that we contain or we end tuberculosis in Kenya, which remains one of the biggest killer diseases in Kenya, and of course how we are doing that in this COVID-19 of course period. We have in studio Dr. Lorraine Nyaboga. She's the chief of party of USAID TBARC and also Center for Health Solutions Kenya. Welcome to the show, Lorraine. On the other side of studio, I have Dr. Elizabeth Onyango. She's the head of the National TB Program. Welcome to the show, Dr. Thank
you.
All right. Just before we get into that discussion, we have some quick numbers and that could give some context of what we are discussing today, if we can get those figures. All right. So these figures are about the burden of TB in Kenya, and these figures are from 2019. 86,504 patients are the number of people who were reported with the TB in Kenya in 2019, and 10% of them were, of course, children. And just another very important statistic that we will be discussing shortly with my panelists is that most of the people who are affected by TB are actually young, between the ages of 15 to 35. We'll discuss what that means to the household and the economy in general. And in terms of fatality or mortality, that's the death rate. This is placed at 37 cases per 100,000 people. Again, they'll be helping us explain what that means. But moving on, this is from 2017, the social economic challenges related to TB in Kenya. 62.5% of people who had TB are said to have lost their jobs due to the disease, of course. 9.3% of households' children disrupted their school-going activities, meaning 9.3% of them could not even go to school because of the disease. 36% experienced, of course, social exclusion, and that is in relation to the kind of symptoms and the way the disease affects you, and you end up being, of course, excluded by the society. We move on. 27.8% took loans and sold assets, that is household assets, for treatment. And this figure, by the way, is also very important in our discussion this morning because it gives context to how much of a burden treatment for this disease means at the household level, and also over 50% of them were malnourished. And finally, let's look at the cost of treating tuberculosis in Kenya. This is the median cost, and again, this is also from 2017. For drug-sensitive TB, the median cost was 26,041 shillings, and for drug-resistant TB, the cost was 145,109 shillings. That's the median cost of treating tuberculosis in Kenya. Once again, as I mentioned, the experts that we have in the studio this morning will be helping us to break down what this means. And of course, we want you to be part of this discussion. You could follow the discussion on social media. Remember, on our question of the day, we asked you, do you know anyone who is suffering from TB? Do you know anyone who is suffering from TB? And how has, of course, COVID-19 affected how they treat and manage the disease? Be part of this discussion on social media. Tweet us at NTV Kenya, at Victor Kiprop _. You could also use the hashtag #NewNormal and follow the discussion on Instagram and Facebook. But for now, let me bring in my guests. Of course, I'd introduced them once again. Dr. Lorraine Nyaboga, she's the chief of party at USAID TBARC and Center for Health Solutions Kenya. And on the other side of studio, we have Dr. Elizabeth Onyango. She's the head of the National TB Program. Now, let me start with you, Dr. Onyango, because we are all in the midst of COVID-19, and people don't even remember these other diseases which tend to be neglected because we are all fixated on COVID-19. But just give us a brief update about the war against tuberculosis in Kenya so far.
Thank you, Kiprop. And I want to thank you also for inviting us just to shed more light on tuberculosis and the situation in Kenya. Tuberculosis, we all know it's a very old disease, ancient disease. It has been there for many years. And throughout generations have tried actually to combat this disease. And today we mark over 130 years from the time when the scientist Robert Koch discovered the bacteria that causes tuberculosis. We need to know that tuberculosis is an airborne disease. It's caused by bacteria. It is also infectious, and it can spread from an infected person and mainly affects the lungs, and it's spread by coughing, sneezing, any action that removes droplets from the body to the air. And so as a country, we have made a lot of strides in trying to combat and address the issues of tuberculosis. Tuberculosis is real. Sometimes I get asked by people, TB kweli bado iko? But we have to let people know that tuberculosis is still there. As you have seen the figures that we are talking about in this country, on an annual basis, over 140,000 people fall ill with tuberculosis. And they fall ill with tuberculosis, and an equivalent of 33,000, as you have said, per year also die because of TB. That translates to an estimated 90 people per day dying because of TB. And we know that TB is a disease that we can prevent, we can treat, and somebody can get well. Okay. So you have asked, what strides have we made as a nation over the years? We have tried to find more TB cases, because we know we are missing over 40% of people who have TB who do not present to our health facilities, but they have symptoms of TB. And we'll come to now the symptoms of TB. And we want that these people present themselves to our health facilities, because our health facilities, the public health facilities, are well equipped to diagnose the TB, and also to be able to treat TB. Okay. Yes.
All right. I'll come to you briefly about the strides that we've made, because you've mentioned that this is a fight that has been continuing for decades. But let me bring in Dr. Lorraine Nyaboga here. Lorraine, she spoke about 33,000 deaths every year, and for me that sounds like a huge figure. Do you think this is spoken well enough about?
Okay. Thank you very much, Victor, for having us. And as you've heard, every year Kenya loses about 33,000 cases of tuberculosis. That is approximately 90 patients who are suffering from TB die every single day. That is a significant figure. That's approximately 6 matatus crashing every single day, and actually killing these people. So this is a significant figure, and it's something that we need to talk about a little bit more, and to actually think about ensuring our health system is more sensitive, not only to diagnosing TB, but also to creating awareness in the community that TB exists, and that TB is still of major public health concern, particularly in this country. Okay. Kenya is one of the high burden TB countries. We fall amongst the 14 countries that are responsible or have a high burden for TB, TB-HIV, and drug-resistant excuse me, TB. And this is not a good place to be at. And so, despite the efforts that we have put in for decades, TB is still relevant. And therefore, even as we look at the current situation, the current COVID pandemic, we need to still keep our eyes on the ball in terms of addressing the causes of tuberculosis, the symptoms that TB presents with, so that more and more Kenyans can be aware of the symptoms of tuberculosis, so that they can seek care. In the current COVID situation, we've seen a decline in the number of people who are visiting health facilities. We've also seen significant stigma associated with respiratory symptoms such as cough, fever, difficulty breathing, because these are similar symptoms to COVID.
Okay.
And so as a result, we've seen a decline in the number of TB cases that we would normally diagnose.
I like the bit about that we don't talk about it enough. But and people would wonder, why don't we talk about enough about a disease that kills 90 people a day?
Yeah.
And my question to you would be then, do you think this is because we also have tens of other epidemics that we are fighting? We still have malaria, we have HIV, we have TB, we have cancer. Do you think our attention is lost in between all the other issues that we're tackling?
That is very true. And indeed, it's possible that we do get distracted a little bit, but our health system really needs to be able to address all the public health concerns that are present. Remember, TB is the 4th leading cause of death in Kenya, and it's the highest in terms of infectious diseases globally. TB is the leading cause of death. So it is significant enough for us to allocate resources in order for us to address it. It's significant enough for us to actually ensure that our health system is really sensitive to it by empowering our healthcare workers to diagnose and treat tuberculosis, and also creating awareness. Many of us are very much aware of HIV, for example, the way that you can be diagnosed for HIV and how HIV is spread, but not as many are aware about how the symptoms of tuberculosis present. And this is despite the fact that TB leads to more deaths than even HIV.
Okay.
So I think this is a great discussion that we are having, and there's need for us to continue having such discussions.
Okay. And let me bring in Dr. Onyango here, because, I mean, 90 people per day, that's the amount of people we lose every day to TB in Kenya. And from where I sit, of course, it sounds like a big figure, but have we been at a worse position before?
Well, we've come a long way. We've come a long way. In fact, the deaths we are experiencing now have gone down. You remember in the 80s, when HIV just hit many countries, as a country we were also affected, because then over 50% of the TB patients or of the TB patients had HIV, and to us that was a big number. And then the program had not really matured to handle the cases that were presenting, and so a number of there was a quite high death rate then. So with time, we know we have addressed the issues of HIV. Now ARVs are available, and ARV, much as is also a treatment. It's also a treatment, and then also a preventive treatment for us in terms of TB, so that those once the viral load of a HIV positive patient is reduced, then they will not suffer the opportunistic infections like tuberculosis. And so we are having fewer and fewer patients, PLHIV, people living with HIV who also have TB. The co-infection rate has reduced significantly from around 70s in the 90s to currently around 26%. So around only 26% of our TB patients are having HIV.
Okay.
So we know with the strategies and interventions that we have adopted both in the TB and HIV, the deaths are going down. But we can still do more, because if TB is treatable and TB is preventable and it can be cured, so we should not even be talking about people dying of the disease. So deaths, according to us and according to the NTB strategy, should be zero.
Okay. And definitely as a country, we must have, and even across the world, we must have some goals that when we want to actually, end TB in Kenya and across the world. Looking at how we are faring in Kenya, do you think we are moving at the pace at which we should be moving?
We can say we are making strides towards ending TB. It is unfortunate that COVID came and somehow disrupted some of the interventions and the strategies and the case finding and many activities that we have put in place. But despite that, we are still focused on that goal to end TB in Kenya by 2030. And there are a lot of interventions that have been put in place together with other collaborators and other stakeholders, all the way from the community. And we are still getting on track. We don't know when COVID is going to end, but despite COVID being with us, we still have to work within that context, within that space, and ensure that TB is not left behind. Okay. So as a country, yes, we are on course. And if all of us work closely together, we can end TB by 2030.
Okay, of course, we'll be talking about how to sustain this fight against TB in the middle of the COVID-19 pandemic in a short while. But just before we go there, Lorraine, earlier on we spoke about the prevalence of the disease, and we said it's more common in people between 15 to 35, and that is the group of people we'd like to call active, both in the household and even for the country, given how much our country is composed of very young people. But there's a cost to this. How much of a cost is this both to the household and to the country?
Okay. So indeed, TB is a very expensive disease in the sense that it has social implications as well as economic implications. As far as health is concerned, and particularly because the age group that is most affected by TB is really the younger age group, between that age of 15 to 35 and even up to 44. Yeah. When you think about this age group, this is the highly reproductive age group and also economically active age group. So with that in mind, therefore, tuberculosis in Kenya, therefore, has that effect in that we have a big category of economically active young people, and particularly men. We've actually seen the prevalence of TB being almost twice as much in men as in women. So with that in mind, we have to ask ourselves the economic burden that TB has on this country. We know that at household level, if the head of the household is affected by tuberculosis, then we have challenges with finding and making a living for that family. And then, of course, at a higher level, at that economic level, we have this big category of young people who ought to be economically active, helping our country grow, who are unwell. So with that in mind, we can see, therefore, the repercussions or the impact of TB, not only at household level, is so great, and therefore it needs to be addressed with the same vigor with which it affects our economy.
Okay. Yeah, and it's because, and I'm saying this because most of the time we look at diseases in terms of the number of people who are infected, the number of people who, let's say, die of the disease every year. We don't look at the figures that we raised, the number of people who miss school, school-going children who miss school because of TB, the number of people who lose their jobs because of TB, and at the end of the day, we have some sort of a hidden cost. Exactly.
So that is actually the biggest problem. One, we know that TB treatment is free of charge in all public health facilities. And this is something that we need to encourage those who've been diagnosed with tuberculosis to seek diagnosis and actually to seek treatment, because it is free of charge. However, we do have opportunistic costs, those hidden costs that you've mentioned, that have to do with transportation. For our drug-resistant TB patients, for example, they have to visit a health facility every single day to get their drugs, to get their medication. If you're employed, if you're a young man between the age of, say, 20 and 44, for example, that affects your work. And so we do have the repercussions of the disease in that many of those who are diagnosed and on treatment cannot go to work. And so as a result, they are laid off, they are fired because of the disease. And that is a problem. That leads to people who are economically active not being able to make a living, and therefore their households are affected in that way.
Okay. Let me bring in Dr. Onyango here. Lorraine has spoken about brought in the issue of costs, and earlier on we saw the figures that we are putting across. 26,041 shillings for drug-sensitive TB. That's a median cost, and 145,109 for drug-resistant TB. And she's mentioned that it's free in public hospitals. Then where could these figures be coming from? Are these from private hospitals?
Let me clarify something.
Yeah.
The treatment is free for the patients, but there's somebody who bears that cost. And government has put in money. Yes, actually, the government of Kenya through the, and also with other partners, we have Global Fund, we have the USAID, we have CDC, and other like CHAI, all the partners are putting in something so that we are able to buy these drugs, to buy the diagnostic tests, and to make them available in our health facilities. So it's not that it is totally free, it's only that the patients do not pay for the service, but there is somebody who bears that cost. And that is why we are telling our people, yes, we have these facilities, we have the services available, they are free for them. And the government is actually foregoing something else so that we ensure that this, the commodities and the tests and even the healthcare workers, everybody is available to provide these services. So let us access them.
Okay.
Yes.
I'm sure we have a caller online who wants to speak to us, but just briefly before we talk to them then, now that the government is shouldering this cost, why is the cost then, even if it's shouldered by the government, this high?
We know treatment for TB takes a very long time. For drug-sensitive TB, the normal TB that we normally have takes almost, say, 6 months. And for those 6 months, on average, we buy the drugs for around $40. That is almost 5,000 Kenya shillings, or 4,000 to 5,000 Kenya shillings. But again, there are costs that are related to diagnosis, which also the government pays for, like one test costs almost 1,000 to 2,000. Then there are also those other costs that are related maybe to the patient, whatever the patient maybe in cars, in traveling, but that is related to the patient. But we know we have to pay the healthcare worker, we have to service the machines, we have to, the utilities, and everything that is related to the service that is provided to the patient. The cost goes up. For drug-resistant TB, as you have heard, the cost of medicines is very, very, very expensive. And it takes even longer to treat these patients, almost 1.5 years to have them on treatment, 18 months. And other costs also related to accessing the services and maybe going to the facilities, yes.
We'll come back to you in a bit about the importance of finishing your treatment. But even before that, I think we have a caller online. That should be Omari from Nairobi. Omari, if you can hear me, please shoot your question or comment.
Hi, Kiprop.
Good morning.
Good morning, Kiprop.
All right.
I have a question for Lorraine.
Yes.
She said TB is the fourth in line killer in Kenya. Which is 1, 2, and 3.
Yes.
And is polio still in Kenya?
Okay. All right. Thank you. All right. Okay, thank you. That is Omari from Nairobi. And I'm not sure if Lorraine or is it Dr. Elizabeth, we should answer that question. But basically the question is asking is, now that Lorraine mentioned that TB is the fourth highest killer, which ones are the first, 2 and 3, and we still have polio in Kenya. Do we have anyone who wants to talk to about this?
Sure.
All right, Lorraine can talk about it, yes.
Yeah. So we do have quite a number of diseases that have always ranked very, very high in this country.
Yeah.
This include malaria, diarrheal diseases, yes, and pneumonia, okay? So many times these 3 diseases rank higher than tuberculosis. But of importance is that even with pneumonia, especially for children, a lot of that pneumonia is also tuberculosis. Okay. Omari asked about polio. Do we still have polio in Kenya? And the simple answer is yes and no. We've made a lot of strides through vaccination towards elimination of polio in Kenya. However, we do still have very few cases. Yeah, over to you.
All right. Let me go back to Dr. Elizabeth Onyango. Just before we got the call, Daktari, we were talking about the issue about treatment and the cost. And you mentioned that sometimes it takes too long. And I remember when we were young, we used to be told, by the way, if you get TB, you'll get 60 injections. I'm not sure if this is the correct figure. And just talk to us about the also issue of people who, you know, sometimes you get that treatment for 3 months and you feel, me, I'm good to go. You abandon it halfway.
Thank you, Kiprop, for that. I started by saying that TB is an ancient disease. It's actually a very old disease. And for this bacteria to have survived up to this time, it just shows its tenacity, for lack of a better word. It is a bacteria that actually tackling it over the years has been challenging. And that is why we even use combination of medicines to be able to eliminate it. And if you just take it for a few days, then you are not going to eliminate all and clear all the bacterial load. And that's why evidence has shown, and we go by evidence, that it is good that we take this, we take the medicines for the prescribed amount of time, that is 6 months for drug-sensitive TB. So you might just feel a relief of symptoms if you take them for a shorter period, but not all the bacteria has been eliminated.
Okay.
Yes.
All right.
And
just finish. Yeah.
Yes, and you mentioned about the 16 injections.
Okay.
Yes, before we used to have injections, yeah, and actually there were daily injections for 6 months for drug-sensitive TB. But from last year, January, the country transitioned to all oral drugs, so no more injections. Huh?
Okay.
Yes, for
all right.
patients.
I know when we speak about diseases like malaria, we always have areas which are endemic, and we have areas where the disease burden is much heavier than others. I don't know if this is the case with TB, but before we talk about, let's talk about this story in Turkana. And Turkana County is ranked among areas with the highest burden of tuberculosis in the country, raising concern within the county government on how to keep the infections low. Official data has placed the county 6th nationally. To start off, the county has appealed to the residents to seek treatment and also stop stigmatizing those suffering from the disease. Lois Wangoi has these details.
This is a multi-sectoral meeting between health workers, stakeholders and representatives from both national and county governments. Members of the community are present too. The conversation aiming to fight the high rates of TB infections in Turkana.
So it means we have both a high drug-sensitive TB case burden and also a high drug-resistant TB burden. To note is 85% of our clients.
TB, a potentially serious bacterial disease that affects the lungs, has continued to be a challenge here, with children and men being more susceptible to contracting it. Food insecurity in the county has made treating the disease difficult.
85% of our clients are moderately acutely malnourished and severely acutely malnourished. So malnutrition and TB are in a vicious cycle.
His Ekwam is a TB survivor, now turned TB champion. He notes that stigma remains the biggest challenge in TB treatment in his home county.
Wale wamejificha huko kwenye kijiji hawafai wajifiche, kwa sababu tiba yake ukitumia matumizi ya dawa unapopewa. Hiyo dawa utakunywa, hiyo mwezi 6 tu ukimaliza unapona.
According to government statistics, pediatric TB cases in 2019 were 602, while 2,478 adults contracted TB. Lois Wangoi, NTV.
That story by Lois Wangoi highlighting the burden of tuberculosis in Turkana. But I think before we talk about COVID-19 and TB and the nexus between the two, I think we have some feedback because some of you have been talking to us a lot and some of you have been calling a lot. And remember, on our question of the day, we asked you, do you know anyone who is suffering from TB and how has the COVID-19 pandemic affected how they treat and manage the disease? And we have some feedback. We have Korea Thoko. He says, I had TB last year and from my experience, I did not notice any effect of the pandemic on my regular visits to the hospital for medications and tests, rather other than the temperature tests on the entrance that everyone went through. That is good, Korea. Thank you. Do we have more? Yes, we have Nyakwar Anyose. He says, my dad was affected. They gave him the wrong medicine for 2 years. He died last year. Please put qualified doctors to deal with it. And we'll be, of course, getting our panelists to talk about that. But I think we have Karen on the phone. Karen, good morning. If you have your question ready, Karen is from Kiserian. Join us, talk to our experts. Do you have a question or a comment, Karen? Karen?
Good morning to you.
Karen, are you with us?
Naulizaje?
Good morning. Yes.
Good morning to you. Naulizaje?
Yeah.
2018, 2019, sasa nilikuwa na TB. Hello?
What's that? Go.
2018, 2019.
Yeah.
But 2018 nilikuwa na for wrong medication na ndio ni kuna kuanga na complication kama hizo ama nini?
Okay. Okay, again, that's another issue about wrong medication our experts will be talking about in a short while. Thank you very much, Karen. We have Lillian. Lillian from Nairobi. Talk to us, Lillian. Good morning. Do you have a comment or a question?
Yes, sorry, mine was just a comment.
Yeah.
And my comment is that we are giving a lot of attention to service delivery, that is treatment and diagnosis.
Yeah.
Which is also coming at a very high cost.
Yeah.
My wish is we also look at the prevention part, where we have the community public literacy.
Yeah.
And we also engage as far as even children in the nursery school, because if children are able to learn to read and write, then they can be very good agents for the same information in the community and at the household.
Okay.
So that we reduce the burden of costs to the country. And we also strengthen our community surveillance even through children, which has been a very good focus that we have even done for cholera and even for issues like hand washing.
Thank you, Lillian. All right. Dr. Onyango, let me start with you. Two issues from both the comments from social media and the calls that we've received. One of them was the issue of being given the wrong medication. What do you have to say?
Okay. There's the issue of somebody saying that they were given the wrong medication. We have standardized the treatment for TB, both for drug-sensitive TB and drug-resistant TB. And if you go to any of our public health facilities, a few selected private and faith-based facilities, then you'll be able to get the correct treatment. And any treatment that is less than 6 months, then they know that is not the correct treatment for TB. Okay. And I think that's where we're getting a lot of issues.
Okay.
Now, concerning community engagement, yes, we are using multi-pronged approaches to tackle TB. It's not only the treatment and the medicine, but you know we have a lot of community initiatives that are going on, as has been suggested by Lillian. We are targeting everyone and anybody who cares, because TB is a social disease also, we need to involve everyone. So we have community initiative. We are involving our community health volunteers. We have TB ambassadors. We have IEC messages going through. We have messages going through the mainstream media, social media, print, even in the radios, local languages, everywhere. We want TB to be saturated, everyone to talk about TB and to know that TB is still there.
Okay.
TB is preventable. TB is treatable.
Thank you.
TB can be cured.
Thank you, Dr. Of course, our time is running out and we need to talk about COVID-19, which I believe in this issue of TB is a whole new problem altogether. And the latest update by the World Health Organization said an estimated 1.4 million fewer people received care for TB in 2020 than in 2019, which is a reduction of, I believe, 21%. Lorraine, talk to us about the issue of the impact that COVID has had in terms of containing tuberculosis.
Okay. Thank you for that question, Victor. Indeed, the current COVID-19 pandemic has affected and disrupted the health system quite a bit, with a lot of focus moving away from some of the diseases that we would normally have really focused on because of the great impact that COVID has had. And so because of that, we've seen a lot of disruption as far as TB, service delivery, and also care seeking is concerned. The first problem we noted earlier on last year, that is between March and about June 2020, was that because of the stigma, because of the fact that TB symptoms are quite similar to COVID symptoms, a lot of patients were very shy from actually accessing care or visiting health facilities. Many times, and particularly at that time, a lot of COVID patients, once they would present themselves and get diagnosed with COVID, they would end up getting isolated. And so, as you can imagine, many patients who even were diagnosed with tuberculosis had challenges and preferred not to visit health facilities for follow-up and care because of that fear of isolation, because of the stigmatization, you know, that problem of everyone looking at you as a potential COVID-19 patient. So because of that, we've had a decline in the number of patients visiting health facilities with respiratory symptoms. And then number two, of course, we've had many of our health facilities that initially were managing TB patients being converted to COVID centers, having TB isolation facilities being converted to COVID isolation facilities. While all that is very important and good, particularly when you have a new pandemic, those have resulted in disruption in TB services and also in TB access for patients.
Okay. And at this point then, do you think this is something we can afford to lose focus on? So, can we afford to be fixated on COVID and forget about TB?
I think what I would say is that both diseases are important. Any life lost is too much for any parent, any household, any society, any community. So it's important to focus on both diseases because both diseases are important and both diseases do result in deaths. I think what we are saying is that we should continue focusing on tuberculosis because this is still a public health of public health concern to our country, which is a high burden TB country and which is a country that has approximately 90 people dying from TB every single day. So we cannot afford to focus on one disease at the expense of the other. We have to find ways of actually integrating care, of empowering our healthcare workers to actually address both diseases concurrently and actually to ride on the resources that we have allocated to COVID so that we can address TB as well.
And I actually think we have a question related to the same. Let's get to see that question if we have it. Yes, that is Eunice Githagori says, good morning, I'm asking COVID-19 and TB symptoms. Is it same or is there a difference? And I think maybe we can bring in Dr. Elizabeth Onyango to help us answer that question. Dr. Ari?
Thank you. As Lorraine has mentioned, we have some overlapping symptoms between COVID and TB, like cough, presents with cough, chest pain, and fever. But the differences comes in terms of, we know that COVID is a viral infection and TB is a bacterial infection. Both of them seem to be airborne. But okay, I won't get into the detail of science. We have the airborne transmission and droplet to transmission. And that is why when you're talking about the COVID measures, like washing of hands, social distancing of about 6 feet or 1.5 meters, it's because when somebody coughs, or that the droplets that are contained that contain the COVID, they don't fly off long distance like the ones that contain the tuberculosis. So even the way they are managed, yes, we know that I've mentioned this, that TB we can still treat, but COVID, currently we still don't have a cure for it, but we can provide like supportive treatment. It is good now, the vaccine. The last day we didn't have the vaccine, but we are impressed at the speed at which we already have a vaccine for COVID. TB, we also have a vaccine, but we give it to the baby, the BCG vaccines when you're born, but it's just effective for a few years. So yes, COVID, we have similar symptoms. And one thing again I need to mention, we say that TB primarily affects the lungs. Yeah. But again, a number, some 10% of people also can have a TB that is outside the lungs and can affect all other parts of the body except maybe the hair, nail, and teeth. Okay. And briefly, because we are running out of time, then we also have research that shows that people infected with TB and COVID-19 are have three times higher mortality than people infected with TB alone. What is the importance then of making sure that even as we trace maybe contacts and we test people for COVID, we also help in fighting TB in the same, of course, that is combining the treatment maybe for TB and COVID-19? Briefly. Yes, we are not looking at these diseases in isolation. We keep talking about integrated patient-centered approach so that you look at the patient holistically. So as a program, TB program, we are leveraging on the resources of COVID also to tackle TB. We've had situations where we do dual testing for both TB and COVID, so that if you are a COVID patient, we also need to test you for TB and just ensure that it's not TB that you have and treat it appropriately. And if you are a TB patient, we also screen for TB. We also have platforms that are able to test both for TB, just using the same machine to test both TB and COVID, doing contact tracing for both TB and COVID, so that you know, the normal symptoms that you ask, do you have a cough, do you have a fever, chest pain, for TB night sweat. So we also subject our patients to both screening so that we are able to refer or even refer the samples for both TB and COVID for testing and manage appropriately. All right. Lorraine, of course, we are running out of time and we really need to close this conversation. But there is the issue also about how we somehow, of course, over-rely on donors for our treatment for tuberculosis. And I think this has been a concern for even other diseases, including malaria and all that. Just talk to us about this, especially at this time when most countries, by the way, are becoming kind of nationalistic and they're looking inwards.
That's an interesting question. Yeah. And I think one of the things we need to remember is for public health, diseases that are of public health concern, such as TB, HIV, malaria, it's important to engage as many stakeholders in the fight against those diseases as possible. Okay. So Kenya has really benefited a lot from a lot of external support, you know, from partners such as the United States Agency for International Development, the CDC, and the WHO and the like. And that is good because, like I said, this is a disease that has taken quite a number of years, decades actually, to reach where we've reached right now. So the engagement of diverse stakeholders is very important. Okay. However, there is need for the government of Kenya and it has been doing a lot lately towards allocation of funds towards managing tuberculosis. So I think this is a process, and we do appreciate that the Ministry of Health through the government of Kenya has done a lot in actually allocating resources towards treatment. Like Dr. Elizabeth mentioned, we now have the Ministry of Health, of course, taking up the cost of the drugs so that at patient level, that is free of charge. Yeah.
And maybe in just 30 seconds in the closing remarks, then as a stakeholder and one of those who the government partners with, can they be assured of your support going forward even during this period of COVID?
Absolutely. So for us, I think we work in collaboration really with the Ministry of Health through the National TB Program. All our efforts towards addressing TB in the country is in collaboration and in partnership with the Ministry of Health. So I think for us, it's a commitment for ongoing engagement, ongoing collaboration through our funders, that's the USAID, and we'll continue working together on this.
Okay. Dr. Onyango, in your closing remarks, of course, we mentioned earlier the impact which COVID-19 has had on TB, and I think in Kenya, 41 out of 47 counties reported a drop in the cases of TB, and I think cumulatively there should be a cumulative of 8.5% reduction in cases between 2020 and 2019. But we also have goals that we had, the progress that we had made in terms of eradicating TB, and we were certain that at certain point, maybe 2030, 2025, or 2023, we should be able to eradicate TB. My question in your closing remarks then would be, has COVID-19 and the setback that we've had, of course, erased some of these gains?
We all know that COVID has impacted every sector of the society. And even for case finding, for TB case finding, we have been thoroughly affected. Going by the figures presented in 2020, last year, we had hoped to find at least 100,000 people with TB, but we only managed to find 73,000, which was a drop of about 10,000 compared to the previous year. COVID has had impact, but as we are still focused, and we have put in place acceleration plans so that we will be able to double our efforts and ensure that TB, wherever it exists, we find that TB and we treat it and ensure that we have eliminated it. So there's a lot of catch-up to be done, and we are focused on that catch-up. And just remind us that TB is everybody's business. So for us as a country to eliminate TB and end TB, we need to join hands together with everybody who is involved. So be it a child, be it a teacher, be it a healthcare worker, be it a tout, whoever it is, let us please join hands together and end TB.
All right. Many thanks, Dr. Elizabeth Onyango. She's the head of the National TB Program in Kenya. And of course, my guest also next to me, Dr. Lorraine Yaboga. She's the chief of party USAID TB ARC and also Center for Health Solutions in Kenya. And I think this brings us to the end of this discussion. Time has really moved fast, but at least we've been able to sample part of your feedback. We have to go for a quick break, but don't go anywhere, because at the end of this break, at the other end of this break, we have another separate panel which will talk to us about self-help groups, popularly known as chamas, what they mean for the economy, the role they play in plugging the gap in financial inclusion, and how maybe the conversation can be taken forward in terms of digitizing chamas in Kenya. Don't go anywhere.